Hi everybody, this is Allie Orwig with the Indiana Rural Health Association. We appreciate you joining us today. We've got a really great presentation for you. Before we get started, we are going to go over a couple quick housekeeping items. We will be taking questions for a Q&A session at the end of today's presentation. If you'd like to send those in at any time during the presentation, please use the chat function. You can send those to me at CKC. That is my name on today's presentation. I'm listed as one of the co-host panelists today. We'll take those all during the presentation. We will address them at the end. And then at the end of today's session, we will have the option for you to ask your questions verbally. You'll be able to raise your hand and we can unmute your line. Again, we will take those at the end of the session. So do be prepared. We are also recording today's session. We will have that available sometime midweek next week on our YouTube channel. If you have registered for today's session, we will be sending that out to everybody, but we will also have it available for searching on our YouTube channel. That's Indiana RHA on youtube.com. So you can view any of our archived webinars there, or you can always go to our website at indianaruralhealth.org and go to our archived webinar page. So I think that's all of our items of housekeeping covered. And without further ado, I will go ahead and turn it over to our presenters today, Tina Darling.
Hi, everyone. Thank you, Allie. I'm Tina Darling. I am the program coordinator for Connecting Kids to Coverage Indiana. And we are a program at the Indiana Rural Health Association that is funded through the Centers for Medicare and Medicaid Services. And with me today is McCafferty, who's one of our team of 5 licensed Indiana navigators. Next slide, please. This is just our funding disclaimer. It has our funding opportunity number in the event you want to look us up and learn more. Next slide. And I've got some learning objectives today, and before I read them, I want everyone to know that this is going to be a very high-level overview of Indiana's health coverage programs. Thankfully, it is being recorded, so if you miss something or you want to hear it again, you'll be able to go back to our YouTube channel and review it and double-check what I've said. But by the end of today's program, I would like everyone to be able to explain the difference between and among Indiana's health coverage options, including the Healthy Indiana Plan, Hoosier Healthwise and Marketplace. I'd like you to be able to compare the difference in Indiana's uninsured rates before and after COVID-19. And I'd like you to be able to describe the different ways Hoosiers can access navigation assistance for completing the application for health coverage. Next slide. A little bit about our funding. Connecting Kids to Coverage, as I said, is funded through the Centers for Medicare and Medicaid Services, also known as CMS. We are actually a cooperative agreement. It's not really a grant. And what that means is that we work cooperatively with CMS to produce the outcomes from our funding. It is a national campaign with 39 grantees, and this is the first time that IRHA has been awarded a CMS cooperative agreement like this. We're about halfway through, not quite halfway through, our 3 years of funding, which started in July of 2019. We have essentially 4 program goals. First is to raise awareness about health coverage available under CHIP, which is the Children's Health Insurance Program, and Medicaid, and that's what we're doing here today with this Lunch and Learn. We want to create opportunities for families to get their eligible children and teens signed up for coverage. We want to motivate parents to not only enroll their children and teens, but to renew their coverage. This is very, very important because a lot of parents tend to forget that there is a renewal process, and so that's where we can come in and help parents to be familiar with that process. And then with working with CMS, we want to provide outreach guides and toolkits to various organizations so that you can conduct successful outreach activities on your own. And I've put our website on this slide. You'll see it frequently throughout the slide presentation as well. Next slide. So let's look at what health coverage looks like in Indiana, a general overview, just so you can get the context of where our work falls. Next slide. Indiana expanded Medicaid in 2015, and we became one of 35, now 35 states who have expanded Medicaid. This was really important for Indiana because until that time, healthy adults between the ages of 1964 did not have a backup health insurance option if they couldn't get it through their employer, or if they couldn't afford it on their own. So this was very important to the state of Indiana that we get this particular demographic covered. Next slide. And I always like to show this slide. It doesn't have much to do with health insurance specifically, but every year the State Health Department publishes this particular map, and I need to get the 2021. The March 2019 one was the most current one I could get. It illustrates Indiana's medically underserved areas and populations, also known as MUAPs. So any county or area on this map that you see colored in with green or pink or blue, that means there is some sort of shortage of healthcare providers. So while we can get people access to health insurance, sometimes that newly insured person has a hard time finding a healthcare provider. It is our hope, however, that with the restrictions lifted during the pandemic with regard to telehealth and how that can be billed, we are hoping that the landscape of this map drastically changes in future years, if indeed they decide to keep those restrictions uploaded or offloaded, I guess, or we want to make sure that those restrictions don't come back. Sorry for losing my place there. Next slide, please. So I also want to show you what Indiana's insurance numbers looked like before the pandemic hit. Next slide. Here's another map. I love maps because they're a really quick and easy way to illustrate what we're talking about. And this map is from 2018, and it's from the Kaiser Family Foundation, and it shows the uninsured rates for non-elderly people by age. And this non-elderly distinction is important because if you're 65 or over, you're eligible for Medicare. So we want to focus on not only children, but that adult age group between 19 and 64 to help them get insured. As you'll see by the table next to the map, Indiana has about a 7% uninsured rate for children and about 11% for adults, for a combined overall average of 10% of Hoosiers are currently without health insurance. And we know there are a lot of Hoosiers who are eligible for it. And that's the goal of our program, is to find those families and help them get the insurance that they're eligible for. Next slide. Since the pandemic, next slide. More slides from Kaiser. After the declines in enrollments that we saw going into the pandemic, and there was a significant decline going on, this trend began reversing in March, no surprise, when the pandemic hit and people were getting sick, either with COVID-19 or other things. For whatever reason, they were prompted to seek health coverage. So between February and May, we did see an increase in people getting health coverage in the United States in general. Next slide. Here's another illustration of it that I really like. It shows that from February 2020 to May 2020, enrollment increased in all but 3 states. And I'm happy to say that enrollment increased in Indiana. We were not one of those 3 states. And I put a green arrow and a round circle over Indiana so that you can see where we fall. We're about in the middle. Next slide, please. So let's review what options are available for Hoosiers in the state of Indiana. We've got several. The ones highlighted in red are the 2 we're going to focus on today, primarily because our funding wants us to. So we're going to look at Medicaid, or HIP, the Healthy Indiana Plan, for adults ages 19 and 64 that resulted with Medicaid expansion in 2015. And we're going to look at the Children's Health Insurance Program, also known as CHIP. In Indiana, the CHIP program is called Hoosier Healthwise, and you may have heard of that. And it's for children ages birth up to age 19 and some pregnant women. Next week on October 7th, we will talk about Marketplace more in depth, but just so you know, right away, open enrollment for Marketplace is coming up November 1st to December 15th. And if you want to learn more about Marketplace, we'll be talking about that on next week's Lunch and Learn on October 7th. Next slide. So we want to go through some frequently asked questions. These are questions that we get if we're talking to people out in the community, or they'll call us on the phone and say, I don't know how to do this. The very first question is, how do I apply? Well, Indiana has an online application. It's called the Indiana Application for Health Coverage. And I've put the URL in that arrow there on the left side of the screen. Next slide, please. And this is what that website looks like. When you go to the FSSA benefits portal, you will see this. And on the right, I've circled the application link, the link to the application for health coverage. And on the left, you'll notice that you can also apply for SNAP, which is also known as food stamps, and or cash assistance. So Indiana Family and Social Services Administration manages 3 different applications from this one portal entry. We are going to focus on the application for health coverage online. Next slide. So there might be some people who don't have a computer. What are their options if they can't do the application online? Well, you can still do it. You can contact a licensed navigator, and we're going to talk more about that on some later slides. You can go to your local county Division of Family Resources office in person, and they will help you. You can call this 800 number, and you can do the application on the phone that way. And if anyone has a computer and wants to help someone who doesn't have a computer, I've included the URL that shows where you can find your local DFR office as well. But between the link and calling the DFR 800 number, you can find a way to apply in person if you do not have a computer. Next slide. And then people want to know, what information do I need to know? And so we've got a general list here. It can get very specific depending on the person applying. But in general, the names and dates of birth of everybody in the household, a social security number. You don't need a social security card, but a number for those in the household who are also applying. You need to know what your income is from jobs or training, and this is before taxes. And if there's any unearned income that you bring in from disability or social security or veterans benefits, child support, unemployment, that's a big one right now. And then you need to have an understanding of your family and tax relationship. Who do you claim on your taxes, or is there someone who claims you? And again, there's the URL where you can go find out specifically exactly the information that you need to know if you need to dig deeper. Next slide. There are some supporting documents that you will need to have with you when you apply. A proof of identity, proof of U.S. citizenship, the proof of income, which is what we just talked about a minute ago. This is a little bit more detail. And then proof of immigration status. I'm not going to read all of these. Again, if you would like to learn more about them, you can watch this video again, or all of this information is online at the FSSA website or the Indiana Medicaid for Members website. Next slide. And then the question gets frequently asked about, how do you submit these supporting documents? There are 3 general ways you can do that: by fax, by US mail, or you, the client, can hand carry your supporting documents to your local county DFR office. All of these are HIPAA secure, designed to protect your information so that nothing can get stolen or lost and get into the wrong hands. Now, several navigating organizations like ours have figured out some secure ways for you to upload pictures of your supporting documents in similar way that you would upload a picture to Facebook, or you would send a picture in a text message. It just depends on the navigation organization that you work with. Next slide. How long does it take to find out whether or not you've been approved? Anywhere from 45 to 90 days, but it may take not even that long. It's important that you check your status online or by phone to see if there's anything outstanding or that you still need to submit. And when you do that, be sure to have your case number ready. That's the quickest way for the DFR representative to find your case and tell you exactly the status of what's going on with your application. And again, I've provided the URL, so if you have any other questions about that, you can check it out. Next slide. How am I notified? This is very important. Indiana FSSA will only notify you by US mail of your result, whether you've been approved or denied. They will also send any requests for additional documentation by US mail. It's extremely important that if you have applied for health coverage to watch your US mail. Equally important then is if you move, be sure to notify DFR of your new address so that you can stay up to date on any information required for your application. Next slide. Which coverage do I need? Well, this is a question that's actually determined by Indiana FSSA. Based on your application, you will be assigned, if you will, into a health coverage program that's determined by your age and your health status. Generally, children from birth up to age 19 and some pregnant women will go into Hoosier Healthwise. Adults 19 to 64 and some pregnant women may go into Healthy Indiana Plan. And then there's traditional Medicaid for the aged, blind, and disabled. But when we say Healthy Indiana Plan is for healthy adults aged 19 to 64, that distinguishes from the aged, blind, and disabled who fall into traditional Medicaid. Next slide. This is what the Indiana Medicaid for Members website looks like. I just wanted to show that. And I've circled the 3 areas that we're focusing on today: children, pregnant women, and adults. You can go to this website and click on those buttons and you can find out everything that I'm talking about here today and even more detail if you need it. Next slide. So we wanted to talk a little bit more about the health coverage plans themselves. We've mentioned the Healthy Indiana Plan, or HIP, for healthy adults ages 19 to 64. To be eligible for HIP, you just have to be an Indiana resident, and your income levels have to fall within a certain range. Have to be within 138% of the federal poverty level, which is determined every year in January by the federal government. People will automatically be assigned into something called HIP Plus, which does require a small monthly contribution based on your income, but it's the best program because it offers approved dental, vision, and chiropractic visits. There are no copays for prescriptions or doctor's visits. You can choose from one of 4 health plans offered by Anthem, CareSource, MDWise, and MHS. You can earn rewards for wellness and healthy choices. And HIP Plus members are offered things like smoking and tobacco cessation programs. And as I said, it is the preferred benefit package of the Healthy Indiana Plan. Ann, did you want to add anything to differentiate between the HIP Plus program and HIP Basic?
Sure. So HIP Basic is kind of the default line. So there, as Tina said, there is an obligation to pay a monthly contribution. That contribution is based on your income level. It can range anywhere from $1 to $20. And say you fail to make your dollar payment for 2 months. Instead of losing your coverage, people who qualify for HIP Basic, which is 100% or lower of that federal poverty level, they will still keep the basic coverage. They will lose dental and vision, but again, they're not going to be totally without coverage. It will still cover the required benefits of the Affordable Care Act. So again, like Tina said, the Healthy Indiana Plan Plus is the preferred. That's where you want to be for those extra benefits.
Thank you. Next slide, please. And here are the monthly eligibility guidelines for the Healthy Indiana Plan. Medicaid goes by monthly income, not annual. So you can see, for example, if you are a family of 3 and your monthly income is at approximately $2,500, you would qualify for HIP Plus. And you can look at this chart later and play around with different scenarios. Again, on the video that's going to be recorded, this will be available. And then you can also go to the URL I've provided at the bottom of the slide, because that's exactly where we got this information, was from the website. Next slide, please. So Hoosier Healthwise is for children in Indiana. It is the children's health insurance program in the state of Indiana. And there are two packages that are primarily available, Package A and Package C. Package A is for children up to age 19, and it includes pregnant women. And this is for a pregnant woman that is not otherwise enrolled in another Indiana health coverage program like Healthy Indiana Plan. It is a full service plan. It has no copays or premiums. It's a 12-month eligibility period, and the patient can choose her own provider, or the parents can choose the pediatrician or family doctor for their children. Package C is only for children up to age 19, and it has a higher income threshold for the monthly income. It is also a full service plan. It does have monthly premium and cost sharing fees for some covered services, but likewise, the patients and the family can choose their provider. Ann, did you have anything to add about Hoosier Healthwise?
No, and your slides are fantastic, very comprehensive.
Oh, thank you.
Yes.
You helped me make them.
Well, they look really good. No, that's a great point about Package A and Package C. A lot of people aren't aware, and this is where we come in. I'm an Indiana certified navigator. So what that means is I'm certified by the Department of Insurance to assist people with this application process that she's done a great job of laying out. What I noticed in my years of experience is a lot of people assume that because as an adult, they did not qualify, for instance, for the Healthy Indiana Plan or for traditional Medicaid, that their children therefore would not qualify. As you can see in that Package C line, 250% of the federal poverty level is far more generous than the 138% for Healthy Indiana Plan. So this is a great opportunity for us to do exactly what our name suggests, connect kids to coverage, because we see a lot of kids that would qualify, but just simply don't have the information to know that they do qualify.
Right. Thanks. Next slide, please. And so as we showed you the monthly income, maximum monthly income levels for the Healthy Indiana Plan, here they are for Hoosier Healthwise. And to piggyback off of what Ann said, the income thresholds are much higher. So let's take that family of 3 again. And if you go over to Package C, you can make over $4,700 a month, and your children would qualify if you have a family of 3. And so this is really important for people to know. This is one of our main goals for this presentation today, is to help parents know, please don't assume that you may not qualify. Your children may not, your children may actually. And so let's work with you to see what those numbers look like, and we'll get that application submitted on your behalf. And I've also included the URL where you can learn more about Hoosier Healthwise.
And can I jump in?
Sure.
And if in doubt, because adjusted gross incomes and modified adjusted gross incomes, they can get a little difficult to figure out. That's where Navigator assistance comes in. Give us a call. If you're not sure and you just want to know if your children qualify, that's what we're here for. So please don't hesitate with those kind of questions.
Right. Thank you. Okay, next slide, please. And so this is a big question that we've heard a lot lately. What if I was laid off during the public health emergency? As I mentioned earlier, if you have an address change, you need to report that to DFR, but actually you need to report any income changes as well. And this is would include if you've lost your job. However, during a public health emergency, if you were already enrolled in something like the Healthy Indiana Plan, as of March 18th, your coverage cannot be discontinued. And that's an important factor for people to know. You just keep on going as if you never had an end date. However, after the public health emergency ends, please watch your mail and be ready with required documents that FSSA will ask for to get your coverage renewed. And it's going to be a quick turnaround. That's what we're hearing. And so that's the other message we want people to hear. Even though they didn't discontinue your coverage during the public health emergency, there's going to come a time when that PHE will be lifted and you need to be ready to move. So hopefully you can refer back to some of the documents that we have those ready. Next slide. If I am an immigrant, do I qualify for coverage? The answer is yes and no. And we are not immigration attorneys. These situations are always very, very unique from person to person. But generally in the state of Indiana, immigrants with qualified immigration status do qualify. They are eligible for full Medicaid after they've been a lawful permanent resident in the state after 5 years. And then there's something called Package E, which is emergency services only. So you can go to the emergency room and get emergency services and they will be covered. Package E also includes labor and delivery for pregnant women. And is there anything you wanted to add about Package E?
More so on the slide as a whole, much like children, if you have questions about the income levels, same with the immigrant status and whether or not I would be eligible for programs. Every situation is different, like Tina said. Let us help you with that process. Just as a little teaser for next week's Lunch and Learn Marketplace, for instance, does not have that full 5-year requirement as a lawful permanent resident. You might be eligible for a marketplace plan. So we still want to hear from you. When in doubt, ask, and we're happy to help. Package E, a big addition to that last year, in October of 2019, I believe, was a Package B, which covers prenatal and postnatal care for women who would qualify for Package E. That will go 60 days after delivery. So whereas before, Package E would cover the actual labor and delivery, but it would not cover prenatal or postnatal care. So this was a big addition for those who don't qualify for comprehensive coverage, but at least can have the comfort of knowing those items are covered.
Absolutely. Okay, next slide, please. What is an MCE? An MCE is a managed care entity, and it is essentially an insurance company. And if you are enrolled in the Healthy Indiana Plan, in Hoosier Healthwise, or another program called Hoosier Care Connect, you will need to choose an MCE. Currently, Indiana has 4 who work with Medicaid: Anthem, CareSource, MDWise, and Managed Health Services, also known as MHS. Next slide. What if I am denied coverage? Well, you or your authorized representative may file an appeal for something called an adverse benefit determination. The important thing to remember is you must submit that within 33 calendar days of receiving that denial. It can be done by phone, in writing, by fax, or in this case, you can do it by email. And I mentioned something here called an authorized representative, and that's something that we as licensed Indiana navigators can become for you. And I'm going to talk about that in a little bit more, but I just wanted to mention what that is. Next slide. What is a navigator? We are licensed by the Indiana Department of Insurance, as Ann mentioned. We can help you complete the application, and if we become your authorized representative, we can follow your application status. We can actually get into your account and see where things stand for you. We can remind you of missing documents or upcoming due dates. This is a really nice fail-safe for people because if, for example, something gets lost in the mail, which does happen, your authorized representative, your navigator, will also get that piece of information and will likely call you, especially if it's a request for additional documentation, and let you know that this needs to be submitted, and don't forget. So that's the value. One of the values of having a navigator is that we are kind of your wingman, if you will. I know
That's my favorite term.
Ann uses that term a lot. Is there anything else, Ann, you wanted to add about being a navigator or based on your experience?
Lots of things about being a navigator. And I think the name just says it all, navigator. I kind of was hoping they'd call us ambassadors, but navigator works better, really. So we navigate through the system with you, so alongside you as your insurance wingman, basically. The mail is a good point that you bring up, because I have younger kids and they're not as great about checking their mail, paper mail, as much as they should. And it's nice to know you have that backup of someone else that's getting the mail. So when you get it, contact me. When I get it, I'll contact you. So
exactly. Yes, next slide, please. So how do you find a licensed Indiana navigator in Indiana? Well, our program is one of them, and we've talked about what we can do. And we're listed there second on the slide. There's also an organization we partner with called Covering Kids and Families, and they work with lead agencies around the state. And the great thing about CKF is they have an 800 number. So if you're one of those people who does not have a computer, call the CKF 800 number listed here, and they can help you just like your local county DFR office can help you. At our website, we have not only well, you can call us to schedule an appointment, but on our website, we also have a schedule appointment button where you can enter your information. It comes straight to me, and then I assign it to one of our navigators based on the county where you live. Also, Indiana has over 250 locations of what are called federally qualified health centers, or FQHCs. These are funded by HRSA, the Health Resources and Services Administration. And FQHCs are required to have licensed health navigators, licensed insurance navigators rather, on their staff. So you can go to this website at HRSA, type in your zip code, and it'll tell you if you have any FQHCs in your neighborhood. Also, there's a company called ClaimAid, and they usually have a presence in hospitals. So if you are in a hospital setting, you might ask the hospital if they have a ClaimAid rep you can talk to. Next slide. That's pretty much our overview, and we are happy to take questions if there are any.
Yeah, so we did get one question in the Q&A already. If a patient or individual is switching from HIP Plus to HIP Basic, how are they informed of this change?
yes, and that wouldn't really be the patient's preference, because again, that HIP Plus is the preferred level of coverage. However, if that person misses their payments and they basically default back to HIP Basic, they will be notified in mail that that has happened, and that will come from the FSSA office in the mail to know that you have been put in that new tier.
Okay. And we've also been asked to remind what documents are needed to be able to enroll in the insurance.
Yeah, that can vary from case to case. However, consistent documents would be a birth certificate, photo ID, or operator license from Indiana showing residency. Most oftentimes, proof of income for earned income, check stub, or in unearned income situations, Social Security award letter for disability or supplemental Social Security. Great question. Do not hesitate to come to an appointment because you don't feel like you have all the documents. Show up and we'll help with that. I'd hate for anybody to miss an opportunity because they don't have a birth certificate, for instance. We'll help with that.
And the income, they should bring 30 to 60 days,
yes.
Or 30 to 90 days.
Yes, for children, they may retro the coverage back 3 months. So there is a possibility you will have to provide 90 days worth for children. So yes, 60 to 90 days.
Okay. We have one more question that's been chatted in. I will remind any of our live attendees, if you have a question you would like to ask verbally, please raise your hand. We'll be able to unmute your line. You can go ahead and do that while I ask the final question that's been chatted in. One individual says, I'm new to healthcare. What are the requirements for me when I get insurance to see a healthcare provider? Do I get to choose my own provider?
Yep, good question. So as Tina talked about, MCEs, managed care entities, fancy word for insurance company. So those programs through Indiana Medicaid that require MCE, or you're placed in an MCE, for instance, Anthem. Anthem does have a provider network provider list, and you can look at that prior to selecting your MCE. So generally speaking, Medicaid is very comprehensive about providers. So I would say that the choice would be there for you to choose your provider if that provider takes Medicaid.
Okay, well, we'll go ahead and leave the line open for just a few more seconds. We really appreciate everyone's time today, especially Ann and Tina for sharing this great information with all of us. Again, we have recorded today's session and it will be posted within a week to our YouTube channel. We have another session coming up on October 7th. Tina, do you want to talk a little bit about that to encourage people to attend?
Yes, thank you for going to the next slide. We are going to have another Lunch and Learn next Wednesday about Marketplace, and it will be a similar format, FAQs about Marketplace. We'll talk about plan levels, the application results, what are tax credits, the cost share savings that are available. So we really hope that you'll participate in that, and we'll be able to make the distinction between what we talked about today and what Marketplace looks like and your options there.
Yeah, I'm really excited about the Marketplace Lunch and Learn.
Yeah.
It's always like Christmas for me to see what plans come out, said the insurance nerd.
Okay, well, thank you, everybody. We appreciate your time today, and hope you all have a great afternoon.
Thank you.
Thank you.